I'd say the care pathway has its positives, and it can be helpful, but there's a lot of things that I think are not really considered and could be worked on.
From a child, it was amazing, and then you transition into an adult, and that's where it starts to get a bit rocky.
When I need to communicate with the ambulance service is only when I'm going through my acute pain during times of emergency. And it's those times they don't understand because they're still confusing and relating my pain to my everyday life, my chronic pain. So sometimes you'll call and they don't see it as an emergency and they're like, we're really under pressure right now. We're only coming out for people with heart issues or if you're not breathing. And it's like, well, I'm gonna stop breathing if an ambulance doesn't get here within the next hour, especially if you're having an acute chest syndrome.
Sometimes a paramedic will turn up to my house and go, what's wrong? And you explain to them, but you're listening to music because with me as a person, music keeps me calm. Maybe the melody of the song keeps me going. So when they see you like watching the TV or whatever, they believe like you're not in crisis and the attitude from there changes.
The pediatric hematologist team, they have enough knowledge to be able to care for sickle patients. However, when you transition into adult, the nurses have to care for a range of patients. So I feel like they don't have time to learn about one certain condition.
When you come into A&E, there's so many different nurses that have no clue. And if they have heard of sickle cell, they still do not understand the level of pain you're in.
I can't really complain. I've been blessed to be able to get the right amount of care and the correct care until there was a situation where it was like, I'm asking the nurses, I'm telling the nurses what I need, and they're just choosing to ignore it.
Sometimes you can have a care plan in place, a tailored care plan in place, and you come in, they don't follow it because of what's happening, because of the culture of that particular hospital. There's so many gaps because I'm like, okay, so does my life depend on what kind of day my hospital is having? And it hugely does, and it shouldn't depend on that. It should depend on good care.
The fact that sickle cell is one of the largest leading diseases that are happening around the world, I just feel like there should be more attention on it, just as much as there is on cystic fibrosis, haemophilia, cancer patients. I feel like we're not being heard enough because of our skin colour or our race.